Good evening, Dr. Okundaye.
Well, good evening, Miss Doreen.
Thank you for taking this show tonight. For the sake of my viewers, Dr. Okundaye is an internist practicing in the state of Wisconsin for over 25 years. And I would say to my viewers at this time, please subscribe and like and share in case somebody might benefit from this show tonight. So, Doctor, I want you to, if you don't mind, address one concern that I notice is prevalent in some of the questions that my viewers ask. Some of them want to know, and they just happen to be young people, about headaches. And the one that seemed to catch my attention a lot is the migraine headaches. And this particular viewer says that she's been having headaches for years, and she says that she has tried everything, a lot of different prescription, and nothing has helped, and she is settling to just live with pain, and it's crippling, and she doesn't know that she can do anything more than is needed out of life. That's a serious condition.
Apparently so. That is so upsetting to
Yes.
hear the degree of disability that
Yeah.
is coming from those headaches. I have to say that what she's describing, it sounds like she already knows migraines. We
Mm.
should start maybe by defining what migraines are. And
Mhm.
generally speaking, people who have them know because they tend to have a family history, or they have people around them that have described those to them. And so, especially
Yeah.
when it occurs in family members, then you're able to say, aha, this is what my mother or my sister was
Yeah.
experiencing.
Yeah.
Generally, migraines tend to run in families among women,
Mm.
and many different people experience different inciting factors, but
Mm.
generally they tend to be oppressive headaches that are associated with, some premonitory signs such as nausea, such as
Yes.
what we describe as aura being, it can come in many forms. It can be sound sensitivity, light
Yeah.
sensitivity,
Yeah.
um, and that association with nausea, and you want to be
Yeah.
in a dark place and you want
Mm.
to not be bothered. You just know to protect yourself by going to lie down
Yeah.
or be
Yeah.
in a quiet room.
Mm.
So those are the most common associations with headaches, and quite
Yeah.
often they can be on one side of the head,
Yes.
and can affect one eye, one side of the face.
Mm.
Those are
Yeah.
subtypes of migraines as well. And when they go even to the next level, then people actually start to throw up.
Oh,
Very,
yeah.
very disabling, very
Yeah.
disabling.
Yeah.
Um, just like the person who, your show
You.
viewer,
Mhm.
who mentioned this, what seems to be very disabling headache. I
Yeah.
would I
Yeah.
would say that migraines run the whole spectrum,
Mm.
from mild and infrequent to severe and oppressive,
Yeah.
and the treatment options would depend on the severity.
Okay. Okay, so yeah, so that's very true. It describes it. I remember I experienced migraines as a younger woman. You
Me
know,
too.
yeah, it normally comes with for most women around the time their childbearing age, right? When they're having their monthly cycle, So, but luckily for me, it did go away with that phase of my life.
And
So
that is a very common scenario.
okay,
Hormonal influences play I
a
want to say
big,
exacerbate. Yes, they do
yeah,
exacerbate the headaches, and it's not
yeah,
uncommon that when women get to menopause, they experience fewer of those
Mm-hmm.
side effects.
Okay. So yeah, also like stress. If you're stressed out on the job
That's a
and
huge factor.
yeah,
That's a huge factor.
yeah,
Yes. Yes.
stressed out on the job, fight with your loved ones, or all of a sudden you hear bad news, that can just really trigger it. And
A few other common ones will be lack of rest.
mm,
Yes, not getting enough sleep, because that is an important strategy to minimize the number of migraines that you have. Sometimes you just have to do things to improve your sleep habits,
mhm.
minimize the amount of stress that you have. Some people are able to identify foods that trigger their headaches,
Oh
and
yes,
foods, once you identify those and you avoid them, you tend to get them less often. um,
yes.
some people might be triggered by certain medications. That's less common.
Yeah.
But there are all kinds of variants, and it's very important that we learn to observe our bodies and observe what's going
Yes,
on with our
yes,
bodies. And
yes.
sometimes just by avoiding those, you can minimize the frequency and the severity of your migraines.
That's very true. I had in my case, I was very, very reactive to cheese, like pizza, any cheesy foods or fried foods. And
Mm,
yeah,
mm,
and soy sauce.
mm.
Yeah.
Red
So
wine, red wine
red
would do
wine
that
for some
too
people.
for a
Mm-hmm.
lot of people, yes. And it
Mm-hmm.
is really, there is a chemical called tyramine,
Mm,
tyramine, which is
mm-hmm.
contained in a lot of these foods and wines, the ones that we call the finer foods. And
Mm-hmm.
because they tend to be processed, sometimes you end up with that being one of the components in the packaging or in the bottling or in the aging process or
Mm-hmm.
fermentation. And
Mm-hmm.
so that in quite a few people would trigger the migraines after eating those foods. Again, recognizing it will be key to minimizing the frequency.
Okay. So so yes, it's good for people to know exactly what they're dealing with. And there are ways that it can be resolved. Some people, some of our viewers don't have medical insurance. So their medicines they can get over the counter. And then so those that have their doctors to go see their doctor, they can be prescribed some newer medications in the market now. What do you say to that in the
Um,
short time we got left?
okay, well, for the milder ones,
Mhm.
Excedrin, Motrin, and
Mhm.
Go Rest.
Okay.
For those who have access to a doctor, muscle relaxants help,
Mhm.
anti-anxiety, muscle relaxants. But
Wow.
generally, we try to avoid those because they can
Mhm.
be habit forming.
Mm.
A common combination I've seen that works to abort the headache, and I say
Mhm.
that because there are two general rules of treatment:
Mm.
prevention and treatment.
Yeah.
Prevention are things like the calcium blockers and the beta blockers. You don't need
Mhm.
to know what they are, just talk to your doctor, but those are
Yes.
prescription. Whereas
Yes.
if you're trying to abort a headache, then you might want to use the imitrexes. They're the ergot group of drugs.
Mhm.
Imitrex, otherwise called sumatriptan or Maxalt. Some of
Mhm.
them work better for different people. So that would
Mhm.
be a good one to try. There are
Mhm.
these newer drugs that are out there that you see a lot on TV.
Mhm.
They take advantage of some new mechanisms that are now known to precipitate migraines in the brain, and they interfere with the receptors that
Mm.
are now identified to be a trigger for initiating the migraines.
Mm.
Once you get past the ergots, it's a good idea to see a neurologist.
Awesome, awesome.
This
Yeah.
person needs to see a neurologist. But
Okay.
before she gives up on everything, I'm going to mention this drug, gabapentin. It's an
Oh,
atypical pain medicine, and it covers a lot of not drugs. It covers a lot of medical conditions where the
conditions.
common denominator is pain.
Mm,
So, especially at night, because for some
mm,
people it may make them groggy. You need a
mm,
prescription. It's
mm.
relatively, not a handout pill, but in the
Mhm,
right situation, like for her, sometimes you get relief from some of those agents. So I would say talk to your doctor and probably
okay,
get a referral to a headache specialist who is a
I
neurologist.
agree. Yeah, I agree. So thank you very much, Doctor. I think we may have enlightened somebody today. So I appreciate your time for taking
It's
my question. And please let me see you again. I can pull on you, I hope, if we have any tough questions, please.
Of course, of course.